All right, this is the part two. Um, Write a simple English phrase for each of the medical terms below using your medical knowledge. Look at A and B opposite to help. Hysterectomy. A hysterectomy is the removal of the womb. Menorrhagia. A menorrhagia is referred to heavy periods. Salpingitis. Salpingitis is the inflammation of one of the tubes that connect the ovary to the womb. Cervical biopsy. Cervical biopsy is when they take a piece of tissue of the neck of the womb. Read the conversation between the gynecologist and the patient in C opposite and complete the notes about the patient. Menarche. 12 years. Menstrual cycle 4 to 5 days and age 28 days. LMP 1 52 ago. Menorrhea, no. Dysmenorrhea, no. Discharge, a little white discharge. Now write the questions that the doctor asked. Look at C opposite to help you. Minarch, how old were you when you started to get your periods? Menstrual cycle. Are your periods regular? How long do the periods last usually? AP. When was your last period? Menorrhagia. Would you say that they are light or heavy? Do you get clots? Dysmenorrhea. Do you get period pains? Discharge. Is there any discharge between the periods? What color is it? Complete the case report. One word is needed twice. Look at B and C opposite to help. A 45-year-old woman had been having prolonged or heavy periods lasting for 8 days with the passage closed for 9 months. There was no bleeding between periods or after intercourse. Her periods were not particularly painful. She had not noticed any hot flushes or night sweats, and her general health had always been good. She had taken the oral contraceptive pill until a year previously, when a copper coil was fitted. She had had a normal pregnancy when she was 25. Complete the conversation based on the case history and be opposite. Doctor, what seems to be the problem? Patient, I be getting palpitations. Doctor, how long have you had them? Patient, for about 6 months, but I have heart problems for years with tiredness and shortness of breath. In the end, I couldn't walk more than 100 meters without having to stop. I had to sleep on 3 pillows and I had a mitral valve replacement 3 years ago and that improved things for a while. Make words combinations using a word for each box. Two words can be used twice. Look at B and C opposite to help you. At rest, atrial fibrillation, heart failure, cardiac output, on effort, premature beats, brain edema, cardiac failure. Write the words a patient would use to describe the symptoms below. Look at A, B, and C opposite to help. Dyspnea, breathlessness or shortness of breath, arrhythmia, irregular palpitations, orthopnea, breathlessness when lying flat, edema, swelling. Complete the case report. Look at B, A, B, and C opposite to help. A 60 years old woman attended her general practitioner's surgery complaining of breathlessness on exertion. This had been increasing for over the previous 8 months until it was producing problems at around 500 meters walking on the level. There was no history of chest pain. She had had several episodes fast of palpitations which lasted 20 to 30 minutes and were associated with some shortness of breath. She had noticed some swelling on her ankles. By the end of the day, they disappeared overnight. Complete the table with words for any opposite but a text mark in front of the stressed syllable in each word. The first one has been done for you. Auscultate, auscultation, examination, inspect, inspection, palpate, palpitation, percuss, percussion, What the steps for examining the heart and circulation in order according to the four-stage system? Look at the opposite to help. Measure the heart size. Inspection. Are there any murmurs? Palpation. Feel the radial pulse. Palpation. Look for the clubbing. Palpation. Locate the apex with percussion. Note any thrills. Auscultation. A doctor is presenting the case of a 43-year-old woman at a meeting in the cardiology department. Complete the test of her presentation. Look at the opposite to help you. On examination, she was paraxial with a temperature of 38.5. She was short of breath. Her pulse was variable between 100 and 180 and was irregular in time and force. Her blood pressure was 130 over 80 and her JVP was up 5 centimeters, showing normal movement with respiration. Her peripheral pulses were all present and there was no central or peripheral cyanosis. Her apex bed was displaced to the anterior axillary line but still in the fifth intercostal space. Her heart sounds were very interesting. When she was initially examined, it was noted that she had pensystolic and mid-diastolic murmurs. Her heard best at the apex. When she was examined some hours later, there was a harsh pericardial friction rub all over the pericardium. Our diagnosis at that time was a mitral stenosis and incompetence with a recent onset of pericarditis and atrial fibrillation. Match the two parts of the sentences, look at A, B, and C opposite to help you. 1988 saw the UK launch of left attenuated. There is measles, mumps, and rubella, MMR best seen. Chickenpox, varicella is a common infectious. Become carriers of the virus. Rabies has an incubation period ranging from 4 days to many months. The patient remains febrile, um, with peaks of temperature of 39.5 Celsius. He was admitted with a 4-day history of influenza-type symptoms of fever with rigors, myalgia, and general malaise. Quite a proportion of patients who recover from hepatitis B become carriers of the virus. The central part of Africa is in the midst of an epidemic for pyrexia of unknown origin. Measles, rubella is most infectious during the catarrhal stage. Lyme disease is caused by transmission of P. burgdorferi from animal to man by axotted ticks. PUO stands for pyrexia of unknown origin. Complete the case report on the patient in A opposite. Look at A, B, and C opposite to help. On examination, he looked unwell. His pulse rate was 100 per minute. He had a palpable spleen. The combination of fever and rigors in a patient who has recently returned from Africa strongly suggests a diagnosis of malaria. The incubation period is usually 10 to 14 days. In this case, the patient admitted he had not been taking prophylaxis regularly. The diagnosis was confirmed by the presence of parasites in his blood film. Complete the sentences, look at A, B, and C opposite to help you. An infection which can be treated successfully with antibiotics is curable. Another word for an epidemic is an outbreak. Bacteria and viruses are examples of microorganisms. Someone whose temperature is normal is afebrile or apyrenexial. The common infection with Epstein-Barr virus is known as glandular fever. Thank you.